Hello everybody, and in this presentation we're going to be talking mental wellness and approaches to mental wellness using naturopathic medicine. So here's an overview of our kind of a typical plan or a typical approach that we take when we are supporting people in our programs. Now we think of health as a balance and a state of balance, and to achieve high levels of health and high levels of wellness, it takes some work, but we always have to start somewhere. And there's some foundational pillars and some foundational areas that we have to start with and work our way up till we get to the higher levels of wellness. Now, nutrition is always at the basis. We also include diet and lifestyle changes, basic determinants of health, such as the water we drink, the quality of air we bring in. All those things are very, very important foundational basis elements to all our programs. We then look into hormones. So how are hormones influencing us? We look into sensitivities, and in particularly environmental and food sensitivities. These can be affecting our brain in profound ways. Stress. Stress is a major component to our lifestyle. So we need to support stress, and almost everybody needs a little bit of stress support in our modern world. Then we look into infections, and particularly chronic infections, ones that aren't being picked up on standard tests, but we find that people with either an infection or a parasite or some sort of imbalance in the bacterial flora or microflora of our guts, we find we have lots of mental and emotional fatigue and other problems. We then look into gut health. Once we got rid of infections, we support our gut health to further enhance digestion so we can get the most out of our nutrition. Detox is another component that we can look at. We support the liver through metabolic detox pathways, and we remove things like environmental exposures and environmental toxins from our body. And then we could look into energetics. So energetics are the component. They're an added component to our plan because we always have a foundation in the chemical world. But we all know that our body has energetic component to it, and these can be very important for relieving emotional factors, emotional blocks, and we'll get into more of the energetics at the end of the presentation. So going into nutrition and starting into nutrition and how this relates to mental wellness, we find that people with anxiety and depression often have problems with blood sugar. Now, the definition of hypoglycemia is when blood sugar goes below about 3, I would say. We can measure this with a finger prick and drawing a little bit of blood. And we find that we have, at around 3, we experience symptoms like anxiety, depression, dizziness, panic, and at its extreme, it can be loss of consciousness. It could be a very serious problem. This is generally for people with diabetes that this becomes a problem because they are taking insulin, and insulin will decrease blood sugar, sometimes too much, and this can be life-threatening, and it is a reason for hospital visits for diabetic patients. So in our practice and in most people, we see something called subclinical hypoglycemia. This is when the blood sugar tends to go down, maybe around 4.3, and people start to experience symptoms at that point. They start to experience anxiety, depression, difficulties with concentration. So one thing to remember is that hunger is an anxiety-provoking event, because when you are hungry, when we think about our ancestors, when they were hungry, it was a very anxious, provoking event because they had to get out there and get their food and gather their food. We are now distanced from that, so it's a little less intuitive to think that hunger is an anxiety-provoking event, but our environment has really changed quite a bit in the last 100 years or so, but if you go back from an evolutionary perspective, then you can see why hunger would be anxiety provoking. And we've all seen this. We kind of joke about this, and we call this hangry, when we get angry and hungry at the same time. So basically, with a good program, with a good nutritional program, we will be supplying good nutrients to the body, and we'll be eating at regular intervals and snacking if needed with high energy foods such as fats, and pairing them with healthy carbohydrates and fibers in order to maintain blood sugar levels. It is a common trigger for people with panic attacks to experience the hypoglycemia and then enter into a state of panic. And it can be a trigger for anxiety attacks. The difference between a panic attack and an anxiety attack, the way I like to think about it, is that panic is a complete loss of control, and anxiety is just an overwhelming abundance of anxiety, and that interferes with your daily life. But you still maintain some aspects of control. Another component to nutrition is healthy fats. So the fats EPA and DHA are probably the two most important fats for our brain. Now, if you look at the individual neurons, so here's a neuron right here, and if you look at what surrounds it and divides it from the outside world, divides the internal world from the outside world, that's this area here. We call this a plasma membrane, and it is basically a layer of fat that surrounds all our cells. And all our cells make up our tissues, and our tissues make up our organs. So fats are absolutely essential. And when we eat fats, they get incorporated into these membranes. And there's different types of fats. Some are pro-inflammatory fats, and some are anti-inflammatory fats. So in the brain, we want to pump in as much anti-inflammatory fats as we can. What is also important to understand is that the conducting pathways. So there is a neuron here, and it communicates with another neuron through this conducting pathway. What allows for fast and rapid electrical conduction, communication between the two neurons, are these things called myelin sheaths. These are also fat-containing molecules. So fat is very important for nerve transmission in the brain. So if we don't have healthy fats in the brain, we're not going to be thinking very clearly, and we're going to have increases of incidence of depression and anxiety. So eating a high-quality EPA or DHA in the form of a fish oil or a higher dose algae oil really can go a long way from a nutritional perspective in terms of supporting your brain health. Now, fats are also a wonderful source of calories that are not converted to fats. They are converted to energy, or they are put into tissues as essential components to help stabilize your membranes and help the functioning of your cells. So they make for wonderful calories. So they also support your energy pathways. So they are a nutritional component as well as a medicinal component. Now, in the modern diet, we often have an abnormal ratio of the good fats, which are the omega-3s, to the not so good fats, which are the omega-6s. Now, some omega-6s are very important and are anti-inflammatory, but the majority that we get in our diet are actually promote inflammation. So this is supposed to represent a membrane. So there's the membrane up here that we were looking at. And if you look at the composition of those individual fats, we find that in the typical American and Canadian diet, we have high levels of omega-6s, specifically the bad omega-6s. When we compare that to the omega-3s, we often have very little, because omega-3s mostly come from fish. and marine-based products, and we don't have that as abundant in our typical diet. So as you can see, we have corn, grains, flour, seeds, and seed oils that make up the omega-6s, so those naturally will get put into our membranes. As a result, when there is some sort of a damage, these lipids, these fats, omega-6 fats, they exit the membranes, and then they get acted on by various chemical reactions, ultimately leading to a promotion of inflammation. So when you have high omega-6s in the membranes, you have a pro-inflammatory state. When we consume more fats in the area of fish oils, we then take this ratio down to a ratio of 3:1, which is a more of a balanced immune system and a balanced inflammation pathways. So as you can see here, the omega-3s, when they are higher from adding them into your diet, we get more of an anti-inflammatory response. And we see when this happens, people will have less pain. They'll often have less incidence of asthma or aggravations with their asthma, and they will have more energy and more mental clarity, and it may contribute significantly to anxiety and better concentration. Green leafy vegetables, olive oil, flax, chia, basically plant-based products are precursors of linolenic acid, which is a omega-3 oil in plants. And then we have the EPA and DHA, which are mainly from fish and algae. You can also turn off this pathway by adding things like ginger, turmeric, flavonoids, boswellia, and magnesium. These are all kind of the anti-inflammatory, natural anti-inflammatories that we can get a lot of benefit from. Another major component to nutrition, especially for brain health, is hydration. Now, as you can see from this picture here, that up to 70% of our tissues or of our body composition is water. So water is absolutely essential. All our chemical reactions occur in water. And so you can see water is found in many different places. Water is found within the cells, so all chemical reactions have to occur in water. And then it's found outside the cells, and then it's found in our blood. So it's so absolutely essential. And we find that we don't drink a lot of water. We often get we can get dehydrated. So dehydration can influence our brain and produce things like anxiety, fatigue, and mental fog. And if you're experiencing that, try drinking, increasing your water intake. As a general rule, and that we like to tell people, is take your weight in pounds, divide that in 2, and that is the amount of ounces you should be drinking each day. So, for example, if you weigh 160 pounds, then you should be having about 70 to 80 ounces of water per day, and that's about 2 liters of water per day. And you should be sipping on that throughout the day. For some people, you may have to add some electrolytes, especially if you are highly active. And you can get that in the form of coconut water, and you can get that in the form of electrolyte sachets, and as well food. Food also has electrolyte in it as well. Another major component of supporting the brain and supporting mood is through vitamins like magnesium, B vitamins and magnesium. As you can see here, this is the serotonin pathway. So this is how we make serotonin. We take first dietary proteins, we convert those, and we digest them and absorb them into the body. We get tryptophan out of that. That's an amino acid that gets converted to 5-HTP. 5-HTP then converts to active serotonin. And then that can even be converted into melatonin. This is the major sleep hormone. As you can see, each of these steps is an enzymatic reaction. So we have a little worker here, and a little worker here, and a little worker here that has to take the raw ingredients like tryptophan and make it into the active ingredient. So this job of this worker is to do that, to make tryptophan, 5-HTP, and then we take 5-HTP to make serotonin. These little workers are motivated by vitamins and minerals and nutrients. We call those cofactors. So that makes them work faster and more efficient. So they need vitamins like B6 and folate in order to produce the 5-HTP. And then this worker needs things like magnesium, zinc, vitamin C, and folate to make the serotonin. So we often will supplement with magnesium, zinc, vitamin C, folate, and things like B6 in order to push these pathways and make these pathways more efficient to make more serotonin. We also can give ingredients like 5-HTP in order to boost serotonin. We can get tryptophan from our diet. And in some cases, we could take niacin. And niacin, the way I think of niacin is it's made from tryptophan. So if we have low niacin, we're going to be taking all our tryptophan and producing niacin. And that's going to lead to a serotonin deficiency. And if we give niacin, that's going to inhibit this pathway from occurring. So we're not going to need to convert tryptophan to niacin, and it's all going to go to serotonin. And there's wonderful anti-anxiety effects of niacin, but be warned that niacin produces a flush when you take it, and it also has some liver toxicity. So it's generally not the remedy of choice. At first, we tend to support with these magnesium, B vitamins first, because there's so many other benefits of these in the body, and they're very water soluble and safe. Now going into diet, so we want to eat foods that are going to support our neurotransmitters. These are things like serotonin. So we want to get tryptophan in our diet. We get that from turkey, but also things like cottage cheese, tuna, salmon, cashews. They all have high levels of tryptophan. That's an amino acid. And then we want to add things with B6. So avocado, chicken, watermelon, beans. Those all have high levels of B6. Magnesium foods, so things like avocado, nuts. And then healthy fats, like we said before, EPA and DHA, raw nuts, seeds, fish oil, and flax seeds. Now going back to our program that I tend to follow when I'm working with patients, and we then work on hormones after nutrition. So hormones that influence our brain in profound ways. Our main hormone, the main master hormone organ in our body is the thyroid gland. And the thyroid gland acts as like a thermostat for the body. It kind of sets the level of activity in the body and in the tissues. So if we have a decrease in activity of the thyroid, we're going to have a decreased activity in all our tissues. We'd have low mood in the brain, memory problems, concentration problems, and mental clarity problems. So that's an area that must be investigated if diet and nutrition alone is not proving results, or it should be investigated in all patients showing any sort of mental illness, just to rule it out. We also see things like temperature, problems with temperatures, always feel cold, always feel constipation, weight gain, and fatigue. We run the marker TSH, that's the thyroid stimulating hormone, and that is being produced from the brain, and that goes down to the thyroid and kind of knocks on the door and says, hey thyroid, let's put out the hormones. So if thyroid is not putting out the thyroid hormones, we're going to send more, the brain is going to send more TSH to knock on the door and say, hey, put out more hormones, and TSH is going to increase. We see it increasing in things like hypothyroidism. We then look at the labs and we say, optimally we want to see it between 1 and 2. The reference ranges in the labs are typically between 1 and 5. So anytime above 2, we tend to think, well, the thyroid is maybe not optimal, and we may want to support this with doing nutritional measures. We also could look at something called free T3. That's the actual active thyroid hormone. And we want to have that at optimum levels as well, and we see that about 14.5. Now, it's also important to understand that each lab may set the reference ranges a little bit differently, so 14.5 may not be optimal in another laboratory, so you always have to check the laboratory values and reference ranges first. Then we have T4, and we'd like to see that around 15 and 18. Now, in the clinical setting, I can tell you that where people come in with thinking that they have, when I have a clinical suspicion of thyroid problems, we often see these around more like 13, we see these around 11 or 14, and we see this above 3. And when we support you with nutrition, we often can get these down into normal ranges. And people often feel a lot better. We see a lot of the hypothyroid symptoms going away. So when it's not considered hypothyroid when the levels are still within the reference ranges, but there may be early symptoms of when the thyroid may be starting to go a little off balance, and we may be able to start experiencing that as mild hypothyroid symptoms. We can even have hair loss. We can even have, for many this can be very disturbing and cause a lot of problems, and they tend to not get a lot of answers with their typical doctor's office visit because all the thyroid markers are within the normal range. Even when the thyroid markers are all optimal, we still find that people can experience problems with thyroid, and when we put them on a good nutritional plan, they often feel better. So what we always say is this is all about how you are feeling, and it's extremely important that you know that you are more than just a marker on a lab. And in some cases, in some people, your reference ranges are maybe a little bit different than the average population. So you may feel best at a TSH of 3, for example. So there are lots more to it. And we can also look at other hormones. So when thyroid may be in balance, we often can see other hormones like estrogens, progesterone, and testosterone being out of balance. And those can have the exact same symptoms when they are low as low thyroid. So if someone is in the age group of 50 and older, when these hormones start to decrease in both males and females, we then see symptoms of hypothyroid, but that actually may be an estrogen or testosterone deficiency. So that's something that could also be investigated. Now, next on our list is food sensitivities. Nutrition can either promote health or it can lead to a reduction in health. This is a decision that everybody can make very easily by what foods they put in their body. But hidden food sensitivities may add a level of complexity to the typical nutrition, because these are often foods that are healthy and they may not be bad for some people, but they may not be the best foods for the individual. So we look for hidden food sensitivities. These occur when your body produces a slow mediated immune response to a particular food, and that could lead to inflammation in the body and cause a lot of unusual symptoms. So in kids, we see these as behavioral problems, attention problems, and in adults, we see them more as emotional disturbances, fatigue, and exacerbation of their inflammation, like aches and pains. And I would say that these are probably occurring in kids to an extent, but kids do not hold back on their emotions, and they often exhibit their emotions in terms of behaviors. And adults, we learn to turn off the behaviors, but we still experience the underlying emotional disturbances. So that's very important to understand. These foods are hidden because they occur 3 to 7 days after you ingest the foods, so they're almost impossible to pick out. Other things that make this more confusing is there may be something called a histamine intolerance. These can produce allergy-like symptoms in response to certain foods, but they may not be immune-mediated responses. So when it comes to food sensitivities, we use the word sensitivities because they're not true allergies, and they can encompass other things like histamine intolerance, digestive enzyme deficiencies, like lactose, people with lactose intolerance. So it's much more complicated. You can make modifications and find your hidden food sensitivities through an elimination diet. But again, this can be quite a challenge and very time consuming. So we often use tests like our in-office electrodermal testing to figure out food sensitivities and make that a starting point, or we run blood and send those to a lab and see if there's any immune-mediated reactions to foods. This is very important for brain health because it often leads to what we call mental fog, concentration problems, but it also goes much more, many more health problems like fatigue, and it's very, very important for things where there is any immune-mediated dysfunction, and we see that with autoimmune conditions in particular. So we also, with anybody wanting to maintain mental wellness or increase mental wellness, we have to do a little stress support. We live in very stressful worlds, in a very stressful world, so we need to support an organ called the adrenal glands. The adrenal glands, they produce many of our hormones. They produce testosterone, they produce some estrogens, and they also produce cortisol. And that's the main hormone that they produce. Cortisol is released in response to a stress or that's either a direct stress or a perceived stress. So an upcoming deadline in 2 weeks, cortisol levels are slowly going to increase in the body up to that deadline, and then once the deadline is achieved, cortisol levels will dip down. Cortisol has many different effects. In particularly, it has an anti-inflammatory effect. So that actually suppresses the immune system. So that could lead to illness if the cortisol levels remain high, such as lots of colds, frequent colds. And if cortisol is high, it could lead to blood sugar problems. So this may be an area for diabetic patients to look into. Then we have increased energy. So we often like this aspect of cortisol. We get an increase in energy so we can meet the demands of life. But after a while, we enter into a burnout stage. So it feels good to have high levels of cortisol for a while, maybe a couple of months. Then we enter into a burnout phase. After a couple of months, high levels of cortisol will lead to memory problems. So we see attention problems, we see concentration problems, and mental fog. We also have endocrine disturbances, meaning the other hormones in the body are disturbed when the cortisol level is high, and we get low estrogens, low testosterone, so it affects our thyroid and all the other hormones in our body as well. And that's because cortisol is made up of the same precursor. All these are steroids, and they all come from cholesterol. And if we are using all our cholesterol and our intermediate hormones to make cortisol, then it seems natural that we're going to get less testosterone, less estrogen, and less thyroid hormones. So then we have weight gain. We also see weight gain occurring with cortisol, and particularly we see it in the abdominal region. And then we also see muscle breakdown, so you get a decrease in the muscle mass with cortisol. So with our busy life, cortisol can remain high, often chronically, and for many people, especially experiencing extreme levels of stress or high levels of stress, they may have an illness, they may have a chronic illness, or they may have depression, anxiety. We tend to see this hormone high, and over the years it has disastrous effects on our body. To recover from it eventually can lead to what we call an adrenal burnout, and once we're in burnout, it's very hard to get out of it, but you have to rely on stress management techniques, but we often add in some pretty aggressive nutritional therapy as well to support our adrenal glands to get them engaged again. One thing I wanted to mention is that proper adrenal support needs to be a minimum of 1 calendar year, especially if you've entered into a burnout stage. One of the biggest setbacks we see is that people will often do adrenal support for a couple of weeks, maybe a couple of months, and then they often stop because this is something that they need to be on for long periods of time in order to get out of. Another avenue that we can investigate in terms of the mental wellness is we can investigate chronic infections. So it is well known that UTIs will produce a lot of mental changes or behavioral changes, especially in kids and elderly. They can produce mental fog, they can produce memory problems and thinking problems. But other infections in the body also have an association with mental clarity and things like anxiety and low mood. Candida is one common infection that occurs after taking antibiotics. The symptoms of that would be things like gas and bloating, basically irritable bowel syndrome-like symptoms, but then we see a lot of skin rashes associated with this. We may see nail infections, fungal infections in the nails as well. Lots of yeast infections in females and rashes in the skin folds of people. It will often be an indicator that you have a candida infection. And that starts in the gut and then moves and becomes systemic. And our immune system will react to it, a low-grade infection, and that can cause mental clarity problems. We have another problem called SIBO, small intestinal bacterial overgrowth, and that's similar to candida, but it's bacteria that is overgrown. This could be good or bad bacteria, and it's really the location. So we don't want to have a lot of bacteria in our small intestine. If bacteria bloom and grow in the small intestine, we get lots of profuse gas bloating that is extremely foul. We often get lots of burping, lots of esophageal reflux, which is GERD, right after eating foods that are high in fructose. So we also can call this a fructose intolerance. And then there's other pathogenic bacteria that occur, and they can occur at low numbers in our intestines, so they don't produce a lot of abdominal gut issues or gut symptoms, but they may produce something called lipopolysaccharide, and that is a potent pro-inflammatory inflammagen we call it. It generates inflammation. LPS enters into the bloodstream and our immune system reacts kind of hyperactively to it, causing a massive inflammatory response. And that's because these bacteria are pathogenic, so the immune system, if it was invading, we'd want to then kill that immediately. Then we can see chronic sinus infections. These could be fungal infections, they could be candida infections, they could be very stubborn, they are often recurrent, and they require long-term treatment with antifungal herbs and antimicrobial herbs, and in some cases antibiotics or antifungals. This is an example of a leaky gut. So gut health is extremely important, and if we have infections like candida, sibo, or pathogenic bacteria producing LPS, we then get a leaky gut. And this is what we call the enterocyte, or the cell lining our gut. And as you can see, it has all these little folds to make it more able to absorb nutrients. Things like glucose, proteins, amino acids, particularly amino acids, they have to go through the cell and into the bloodstream in order to be absorbed. What happens with leaky gut is that things like LPS and gluten cause these links that are usually waterproof to open, allowing stuff from the gut to enter into the body. So LPS can then enter the body, and there's an immune response here. We also could have tears in the lining of our gut lining, in the cells, and that could also lead to leaky gut. So there is blood work to check for leaky gut and to determine the severity of the leaky gut, and to determine if there is more, what the trigger is. Is it more of a parasite, virus, yeast, or is it something dietary like food sensitivity or gluten? And we can measure the level of actin and myosin in the bloodstream, and the things like zonulin and lipopolysaccharides specifically. That's a good one. We can run these, and we can then determine if there's a bad breakdown of the bacteria of the lining of our gut. Once we've dealt with infections, we then want to enhance digestion. And if there's no infections, then we just go on to enhancing digestion. Things we do is gluten-free diet, fish oils, probiotics, fiber in food, glutamine and marshmallow. Gluten-free. Now, we often do see with people, in patients, where people that have mental fog and decline in mental wellness, often are sensitive to gluten and wheat-based products. So it does produce an inflammatory response. It does, in everybody, lead to a little bit of a leaky gut, a transient leaky gut. And in people with, very sensitive, then it does lead to things from the gut entering into the body, and that can produce inflammation and low mood and fatigue. So a gluten-free diet can be very important for mental wellness for some people. And so it's something that could be investigated by doing a 10-day trial of a gluten-free diet. Now, you don't have to have celiacs in order to be sensitive to gluten and to have the many manifestations of problems with gluten. We call that non-celiac gluten sensitivity, and it can produce low mood, mental fog, but also joint pain. So it's a worthy trial to get people off of that for about 10 days to see if it has a response. And if it does, that could be important strategy that is sustainable long term. Probiotics are another thing that we are in the media right now. We're starting to find lots of benefits of having a probiotic in the diet. Probiotics produce neurotransmitters. They can produce GABA, which is another neurotransmitter that can then be absorbed into the body and increase the concentration of GABA. They produce other molecules. They may interact with our nervous system in certain ways to stimulate the vagus nerve, and which directly ties to the brain, causing positive behaviors. So it's very fascinating. We see an increase. I've seen studies where there's an increase in a decrease in the functioning of the amygdala, a decrease in the limbic system with certain ingestion of certain probiotics. So we are seeing that this is becoming more common in the area of mental health and mental wellness to incorporate probiotics as an option in addition to the standard treatments. Going on up, our next area that we may want to investigate at some time is detoxification. We can do this because through supporting the liver. Now, we live in toxic worlds, and you know, everything we put on our body is usually has a toxin. A lot of the foods we ingest usually have pesticides in them. The place where we store foods are usually plastics, and they have chemicals in that leach into the food. So we are living in a toxic world. That's just become normal in our society. So we want to try and decrease as much the toxic load as we can. But after a certain period of time, people start to experience what we call multiple chemical sensitivity like symptoms when they have a high load of toxins in their body, and particularly people who are very sensitive. So gently removing this from the body, supporting what we call the elimination pathways through the liver, the digestive system, through the feces, through the sweat, can really go a long way with decreasing the load in terms of the chemicals in the body. Now, of course, people who are breastfeeding and pregnant can't do this because they don't want to decrease any stored chemicals to their babies. So there's a certain population group that shouldn't be doing detoxifications. And then there's also dangerous detoxifications where there's a lot of sugar involved. So you feel a lot of energy, but you're not supporting detoxification. You're just on a high sugar diet. So there's lots of misrepresentation of the term detoxification. But a true detoxification is really supporting your liver. And we call that a metabolic detox. And we see things like clearer mind, more energy, and way less cravings. Cravings to coffee, cravings to sugar, cravings to the foods that are not well for you. So it can be very beneficial. And for many people, this may be a good starting point. We may start people at this point because it's something you can do to get someone to feel really good really quickly, and it's something I do personally on about 1 to 2 times a year. I'll go on a 1 or 2 month metabolic detox, and I still eat my foods. I eat a very clean diet, hypoallergenic diet, eat regularly, lots of protein, lots of amino acids, but I add in liver support, and I'll often go for a couple of months or maybe a month to really support myself. And during those times, I know I do feel clearer mind, more energy, and less cravings. I often will stop drinking coffee in the mornings. I won't need to drink it. So it's very beneficial, and it has far-reaching effects on our health. Proteins, amino acids are very important for proper detoxing. We also can call this cleansing in a way. Beets, carrots, artichokes, lemons, parsnips, dandelion greens, watercress, burdock root are all foods that we can add to the diet to help support detox pathways. Obviously, we want to not go on sugar because sugar does shut down the detox pathways. Stress shuts down detox pathways, so we want to have good stress management and not excessive exercise because that'll shut down our detox pathways. And we have herbal tinctures, herbal remedies, whole herbs that we can add to food. So I look at those as food things that we can add as dietary and food medicines to further enhance detoxification. Now, this is an interesting area to review. It is bioenergetics. Now, bioenergetics is wonderful for opening up suppressed emotions, and these could be really interfering with achieving the highest level of mental wellness. These are things we don't talk about in the mainstream. These are very alternative, and they're more the art of naturopathic medicine. We use things like homeopathy. We use things like low dose botanicals that are a very low dose that are supposed to allow toxins to be released from within our cells. And things like flower remedies, rescue remedy is one example. Homeopathics that are tied to the individual person and individual pictures. So there's lots in this area, but it can lead to a very fast change in your health. And I find in my clinical practice to be a very rewarding area to be focusing on with our patients when we have a good solid foundation in our nutrition, particularly. We see and we are detoxing properly, we tend to get good responses with the bioenergetics. We have a variety of ways to test for bioenergetics. One thing that we do is the electrodermal testing to determine food sensitivities or food imbalances that may not be in tune with our body. So these are foods that might not be bioenergetic balance with our body. And then we also can do organ testing to determine if there is a dysfunction in a particular organ that's not it may not be pathological, but it may be the early signs of very, very early preclinical stress on that system. So when we support those systems that come up, we often see a faster resolution to the health problem. So we use these as tools in our practice. What is also particularly important with any mental wellness program is dealing with internal self-negative thoughts. Automatic self-negative thoughts are very common in people with depression and anxiety, and they're thoughts that'll probably never disappear. But when we can identify them, we can then begin to understand that these are not normal, they're part of the pathology, and we start to have less, we don't let it interfere with our ability to carry out our life. Negative thoughts may be low self-esteem, low self-worth, and when we can identify that as a pathological thought that is part of the disease, we can then begin to disregard it in a way, and it can really lead to a profound change in our mental health and mental wellness over a long period of time. It's a lot easier said than done, and it's something that a lot of people may have to work with a clinical counselor in order to get these internal self-thoughts that are deep-seated in order to manage them a bit more. But we can all benefit from a little bit of work in this level as well. And then there's symptomatic support. So when people are experiencing anxiety, and even depression, there's lots of avenues you can go to really balance your moods and balance your overall body using natural medicine that are effective. So please don't hesitate to seek out care of our clinic if you are experiencing these problems. Another thing that should be noted too is that if you are on antidepressants or any sort of mood-altering medications, a lot of the botanicals that we discuss have interactions with these, so you have to be very cautious, and I would highly recommend working with a healthcare provider, like a naturopathic doctor, if you're planning on trying alternative medicine along with conventional medicine. All right, so that's our talk, and that's our base of my approach to enhancing mental wellness. Everybody's where, this is a foundational area, and then we may mix these areas depending on the individual. And we may say at this level, focus on detox. But as we work up by developing our foundation and we build, we get a better sense of balance in the body. And ultimately at the highest level, our bodies are in balance and we have high level of mental wellness. And that is defined with having lots of energy, lots of motivation, lots of good relationships in the community, and overall just the highest quality of life possible. All right, so thanks everybody for attending, and I look forward to our next group session.